Hello, everyone. This is Doug Nelson with Precision Neuromuscular Therapy, and I'm here with James Zabasca, one of the teaching staff as well. And the purpose of this video is just to demonstrate something about anatomy and how we get the ideas that we treat from. And the bottom line with that is that if I am to treat a particular muscle, in this case, it's the pectoralis minor, oftentimes the images that we have in our head guide our treatment. But the larger question is, where do we get those images? And oftentimes the answer is from an anatomy picture, either a book we have or an app we have on our phone. Or I think it's just really important to remember that those images are images and they're generalities, but that's an image and this is a person. And those two things can be quite different. As an example, and just happened to, James and I were just together working on things for the portal, and I just happened to check something with him. And let me show you this. If James rolls his shoulder forward, again, this is not a humeral motion as much as it's a scapular motion of anterior tilting of the scapula, which is the providence of the pectoralis minor. When he does that, I can feel his pectoralis minor firing. I can add a little resistance as he does that. And this is the upper fibers of his pec minor. That's very different than if he did it as a humeral motion, that's pec major. But his pec minor is angled, the first head is like this. Look at the angle of that pec minor. That is probably unlike any anatomy picture you've ever seen of the pec minor. Most of them look like this kind of thing. Well, that's great in a picture, but the picture is not James. So that brings up, again, just a reminder that we have to be, and it's necessary to have those images in our head. We have to gather that information, but we have to relegate that with the person in front of us. Knowing what the muscle function is, knowing that the images, guidelines in our head, if possible, have the person activate that muscle to trace the exact anatomy on that person. Again, the images are guidelines. Guidelines are simply that. The guideline is not necessarily the reality. And this is really true, whether pec minor is a great example in this case, but you could do the same thing for the external oblique or the internal oblique or the serratus posterior, inferior. Whenever it says it attaches to this rib and that rib, again, that's in most people, but most people is not the person on the table. So I think we have to balance those two sides of the equation. Our cognitive and our kind of historical understanding of the muscle that we get from anatomy books, again, buffered with the idea of our palpation skills to refine it for the person that we're seeing. So I hope you find that valuable, and I think there are multiple ways in the body that you can apply that. Hello, everyone. This is Doug Nelson with Precision Neuromuscular Therapy. If you enjoyed this video and you would like access to hundreds of training videos, consider joining the PNMT portal. With that subscription, you'll have access to videos that are over assessment, over anatomy, treatment videos, and a host of resources that I think you'll find it very valuable to your daily practice. There's a link below, and hope to see you in the portal.